For years, you've likely viewed your medicine cabinet as your safest ally. Perhaps a doctor once mentioned these pills were safe enough for daily aches or reflux, and they've stayed there ever since, like old friends. But what was harmless for your body at 40 can become a silent, heavy burden by 65. Our bodies evolve, yet our medication routines often stay frozen in time. Think of your heart as a reliable pump. If you suddenly thicken the fluid or tighten the pipes with the wrong chemicals, that pump has to work twice as hard just to keep you upright. I'm Dr. Eric Whitman, a cardiac surgeon. For 15 years, I've witnessed the consequences of these harmless drugs, common medications for pain or heartburn that slowly strain your heart muscle until it can no longer adapt. This isn't just about a diagnosis. It's about your independence, the ability to drive, garden, and live on your own terms. Fortunately, you still have control, and a few small adjustments can protect your future. Comment check if you're ready to review your cabinet, or new if this surprises you. When you walk into a CVS or a Walgreens, there is an entire aisle dedicated to pain relief. You see bright bottles of ibuprofen, known commonly as Advil, or Motrin. You see naproxen, which many of you know as Aleve. And perhaps you've been prescribed diclofenac, or Voltaren, for that persistent ache in your lower back, or the stiffness in your knees that makes the stairs feel a little longer every year. In the American household, these are seen as staples, as essential as milk or bread. We've been conditioned to think that if it's available without a prescription, or if it's been in our medicine cabinet for a decade, it must be safe. But as a cardiac surgeon, I look at these bottles through a very different lens. I see them not as simple pain relievers, but as powerful chemical agents that interact with your cardiovascular system in ways most people never realize. For someone over the age of 60, taking these medications, which we call NSAIDs, non-steroidal anti-inflammatory drugs, without strict oversight is what I call medical Russian roulette. You might pull the trigger for weeks or months and feel fine, but the mechanism for a cardiac event is being set in motion silently. Let me tell you about a patient of mine named Robert. Robert is 72, a retired engineer, and a man who takes immense pride in his rose garden. To Robert, being able to prune his bushes and haul mulch is his quality of life. It's his independence. Like many of you, Robert has osteoarthritis in his knees. To keep moving, he started taking diclofenac every single morning. He didn't think twice about it. It worked. The pain faded, and he could stay in his garden. However, the harmless pill began a slow, invisible war on his heart. One Saturday morning, Robert noticed he was unusually exhausted. He blamed the humidity. Then he noticed his breathing was shallow. By the evening, his ankles were so swollen that his skin felt tight and shiny and he couldn't get his loafers on. When he arrived in my ER, he wasn't having a heart attack in the traditional sense, but he was in acute heart failure. His heart, which had been managing just fine with a bit of age-related stiffness and mild high blood pressure, had suddenly decompensated. The trigger? That daily anti-inflammatory. To understand why this happens, I want you to visualize a pump and pipes analogy. Your heart is the pump, and your arteries and veins are the pipes. To keep the house running, the pressure in those pipes needs to be just right. NSAIDs work by blocking certain enzymes to stop pain, but those same enzymes are responsible for protecting your kidneys and keeping your blood vessels relaxed. When you block them, two disastrous things happen. First, your kidneys start to retain sodium and water. Imagine suddenly dumping an extra 5 gallons of fluid into your home's plumbing system. The volume goes up, and the pump, your heart, has to work significantly harder to move that extra weight. A 30-year-old heart can handle that extra load, but a 65 or 75-year-old heart often has what we call diastolic stiffness. It doesn't relax as easily. When you add extra fluid volume, the heart gets overwhelmed, and fluid starts backing up into the lungs and the ankles. That's exactly what happened to Robert. Second, NSAIDs cause the pipes to constrict. They narrow your blood vessels, which naturally spikes your blood pressure. If you are already taking a pill for hypertension, the NSAID can actually cancel out your blood pressure medication. You think you're protected because you took your lisinopril or amlodipine, but the ibuprofen is working behind the scenes to keep your pressure high. And here is a detail most people miss: the aspirin conflict. Many of you take a baby aspirin, 80 mg, every day to prevent a heart attack. If you take an ibuprofen shortly before or after that aspirin, the ibuprofen actually physically blocks the aspirin from reaching your platelets. It's like putting a cap on a bottle. The aspirin can't do its job of thinning the blood, leaving you unprotected against clots while you think you're being proactive. So, what is the path forward? We don't want you to live in pain. Pain itself increases stress hormones, which strain the heart. The golden rule, I tell my patients, is the lowest dose for the shortest time possible. If you have a flare-up, use it for 3 days, not 3 months. I often recommend acetaminophen, Tylenol, as a first-line alternative, because it doesn't affect the kidneys or blood pressure in the same way NSAIDs do. However, for many seniors, topical gels like Voltaren gel are the real game-changer. When you rub a gel onto your knee, only a tiny fraction enters your bloodstream compared to a pill. You get the relief at the site of the pain without sending a chemical storm through your entire cardiovascular system. Always ask your doctor, is there a local way to treat this pain before we go to a systemic pill? Your independence depends on keeping that pump from being overworked. Now, let's move to a medication that is arguably even more common in the American morning ritual, the stomach protector. I'm talking about proton pump inhibitors, or PPIs. You know them as Prilosec, omeprazole, Nexium, esomeprazole, or Prevacid. In the US, these are the purple pills that promised us we could eat whatever we wanted without the burn of acid reflux. Many of my patients are put on these drugs temporarily for an ulcer or severe GERD, but then they stay on them for 5, 10, or even 15 years. They become a safety blanket. In fact, many people are prescribed PPIs specifically to protect their stomach because they are taking the NSAIDs we just talked about. This is the great irony of modern medicine. We give you one drug to fix the side effects of another, and in the process, we create a third, even more dangerous problem for your heart. Take the case of Ellen. Ellen is 68, active, and had been taking omeprazole every morning for nearly a decade. She didn't have heart disease in her records, but during a routine checkup, her EKG looked erratic. It wasn't a heart attack, but her heart's electrical system was misfiring. When we ran her blood work, we found the culprit. Her magnesium levels were dangerously low. Magnesium is what I call the conductor of the cardiac orchestra. Every single heartbeat is an electrical event. For that electrical signal to travel smoothly and tell your heart when to squeeze and when to relax, you need magnesium. Without it, the orchestra loses its rhythm. You get palpitations, skipped beats, or even dangerous arrhythmias like atrial fibrillation, AFib. Why did Ellen's magnesium drop? Because PPIs work by shooting down the acid-producing pumps in your stomach. While that stops the heartburn, you actually need that acid to absorb vital nutrients like magnesium, vitamin B12, and calcium. By staying on a PPI for years, Ellen had effectively starved her heart of the minerals it needed to keep a steady beat. But the risk goes deeper than just minerals. There is a growing body of research concerning nitric oxide. Nitric oxide is a molecule produced by the lining of your blood vessels. Think of it as the lubricant for your arteries. It keeps the vessels flexible and slippery, so blood can flow easily and clots don't form. Recent studies suggest that chronic use of PPIs can impair the enzymes that produce nitric oxide. When you lose that lubricant, your arteries become brittle and sticky. This is a recipe for a heart attack, even in people who think they are doing everything right. Furthermore, if you have already had a heart event and are taking a drug like clopidogrel, Plavix, to prevent another one, you must be extremely careful. Omeprazole can interfere with the liver enzyme that activates the Plavix. In simple terms, the stomach pill can turn off your heart protection, leaving you vulnerable to a second stroke or heart attack without you ever feeling a difference. My advice for you is not to stop your PPI tonight. If you stop cold turkey, your stomach will often produce a rebound of massive amounts of acid that will be incredibly painful. Instead, I want you to have a tapering conversation with your doctor. Ask them, now that I'm over 60, is the risk of this PPI outweighing the benefit? Can we move to a less aggressive H2 blocker like Pepcid? Or can we focus on lifestyle, like not eating 3 hours before bed and avoiding trigger foods, so I can get off this medication? If you must stay on it, insist that your doctor checks your magnesium and B12 levels every 6 months. Don't let a stomach protector become a heart weakener. I want to pause here for a second because I know this can feel overwhelming. You might be looking at your pill organizer right now and feeling a sense of anxiety. Please take a deep breath. My goal is not to leave you feeling helpless, but to give you the insider knowledge that the current medical system often fails to provide. In the United States today, the average primary care visit lasts only about 15 minutes. In those 15 minutes, your doctor has to review your labs, check your vitals, and update your prescriptions. They are often so rushed that they don't have the luxury of looking at the long-term crosstalk between your stomach meds, your pain meds, and your heart. They are treating the symptom of today, but I want to help you protect your health for the next 20 years. You are not being a difficult patient by asking these questions. You are being an informed advocate for your own independence. If you find this level of detail helpful, the kind of explanation you wish you had time for in the doctor's office, I invite you to join our community here by subscribing. Our mission is to bridge the gap between complex science and your daily life. Also, please consider sharing this video with a friend or a spouse. Many of us are co-managing our health with our loved ones. If you start this conversation today, you might prevent a crisis for someone you love tomorrow. Just one click can start that dialogue. Now let's get back to a category of medicine that almost everyone uses during the winter months, but which can be a direct jolt to an aging heart. We have all been there. You wake up with a crushing head cold, a stuffed nose, and the inability to breathe. You want a quick fix so you can get through your day or get a night's sleep. You reach for the D version of your favorite cold medicine, the ones that require you to show your ID at the pharmacy counter, or anything containing pseudoephedrine or phenylephrine. These are marketed as magic solutions for congestion. And they work, there's no denying that. But for a person over 60, that relief comes at a very steep cardiovascular price. Consider Martha. Martha is a 75-year-old retired school teacher, someone who stays active in her community and loves her daily walks. Last winter, she caught a nasty respiratory virus. To help her breathe, she took a standard over-the-counter multi-symptom cold and flu liquid that contained a decongestant. Within 2 hours, Martha felt like her heart was thumping against her ribs. She felt dizzy, developed a pounding headache, and her vision became slightly blurred. When her son checked her blood pressure at home, it was 190/110. Martha was in a hypertensive crisis. She had no history of blood pressure this high. The culprit wasn't the virus. It was the magic decongestant. To understand why, let's go back to our squeezed hose analogy. Think of your blood vessels like a garden hose. A decongestant works through a process called vasoconstriction. It physically shrinks the blood vessels. In your nose, this is great. It shrinks the swollen tissues so air can pass through. But the pill doesn't know you only want to shrink the vessels in your nose. It travels through your blood and shrinks the vessels everywhere. Imagine you are watering your garden and someone steps on the hose. The pressure behind that foot spikes instantly. When you take pseudoephedrine, you are effectively stepping on the hose of your entire circulatory system. Your heart suddenly has to pump against massive resistance. For a young, flexible heart, this is a temporary stress. But for a heart that may have some undiagnosed plaque or age-related thickening, this sudden pressure spike can trigger an arrhythmia or even a stroke. In fact, the European Medicines Agency recently issued new warnings about pseudoephedrine due to its link to rare but devastating syndromes involving the blood vessels in the brain. The risk is real, and it is systemic. Moreover, these drugs are stimulants. They are chemically related to adrenaline. They tell your heart to beat faster and harder at the exact moment your blood vessels are narrowing. It's like slamming on the gas pedal while the emergency brake is on. This jolt to the system is why Martha ended up in the ER with a racing heart. If you are over 60, especially if you have been told you have borderline high blood pressure or any valve issues, my professional advice is to avoid oral decongestants entirely. The safe alternatives are often more effective in the long run anyway. Saline nasal sprays, simple salt water, can wash away mucus without any chemical side effects. Humidifiers keep the air moist so your tissues don't swell. And if you need a medication, talk to your pharmacist about nasal corticosteroid sprays, like Flonase, or oxymetazoline sprays, like Afrin. A word of caution on Afrin. It stays local in the nose and won't spike your blood pressure like a pill, but you must never use it for more than 3 days, or you will get rebound congestion. The goal is to keep your nose clear without putting your heart in the crosshairs. Don't let a temporary cold lead to a permanent heart problem. Your heart has been beating for over 6 decades. It's a finely tuned instrument. It doesn't need the jolt of a stimulant cold pill. In the next section, we'll talk about a much more sensitive topic: how the medications we take for our mind can sometimes forget about the heart. We need to have a very honest conversation about mental health. For many of you watching, you grew up in an era where depression or anxiety weren't things you talked about at the dinner table. You were taught to tough it out. But as a physician, I want to tell you that depression is not just a feeling. It is a systemic inflammatory condition. In fact, clinical depression is a major, independent risk factor for heart disease. It increases cortisol, it raises your heart rate, and it makes your blood stickier. Treating your mental health is, quite literally, treating your heart. However, the way we treat it in the senior population has become a point of deep concern for me. I'm specifically talking about a class of medications called tricyclic antidepressants, TCAs. You might know them by names like amitriptyline, Elavil, or imipramine, Tofranil. While these were the gold standard in the 1970s and 80s for mood, today they are more commonly prescribed in low doses for off-label uses, chronic nerve pain, fibromyalgia, or even as a sleep aid. The problem is that these drugs are dirty drugs, meaning they don't just hit one target in the brain, they hit receptors all over the body, including the heart. In a young person, the heart can usually absorb this noise. In a heart that is 60, 70, or 80 years old, that noise can lead to a catastrophic failure of independence. Let me tell you about Frank. Frank is 78, a former high school principal, and a man who lived for his morning walks and his weekly bridge club. Frank has type 2 diabetes, and like many diabetics, he suffered from neuropathy, that burning, tingling pain in the feet that makes it impossible to sleep. His doctor, wanting to help, prescribed a low dose of amitriptyline at bedtime. For a few weeks it was a miracle. The pain faded, and Frank slept. But one night, Frank woke up to use the bathroom. As he swung his legs out of bed and stood up, the world turned gray. His blood pressure, instead of holding steady to fight gravity, plummeted. Frank fainted. He didn't just fall, he suffered a fragility fracture of his hip. In the medical world, a hip fracture after age 75 is a pivot point. It is the #1 fear of most seniors because it often leads to a loss of the ability to live alone. Frank's fall wasn't caused by old age or clumsiness. It was caused by orthostatic hypotension, a direct side effect of his antidepressant. These old drugs block the receptors that tell your blood vessels to squeeze when you stand up. Without that squeeze, gravity wins, and the blood stays in your legs instead of reaching your brain. Beyond the risk of falling, TCAs have a more sinister effect on the heart's wiring. Your heart is an electrical pump. Every beat follows a specific timing, measured on an EKG as the QT interval. Tricyclic antidepressants act like static on that line. They slow down the electrical impulses as they travel through the heart muscle. If that electrical signal is slowed down too much, it creates a window of vulnerability. If a stray heartbeat happens at the wrong millisecond, the heart can descend into a chaotic, life-threatening rhythm called ventricular tachycardia, or Torsades de Pointes. This is the mechanism behind sudden cardiac death. For an aging heart that might already have some wiring issues or scarring, adding a TCA is like throwing a wrench into a high-speed engine. Furthermore, these medications act as anticholinergics. This is a fancy way of saying they block the rest and digest part of your nervous system. This causes your resting heart rate to climb. I have seen patients whose resting heart rate went from a healthy 65 beats per minute to a constant straining 90 beats per minute because of their pain medication. Your heart is like a car engine. If you leave it idling at high RPMs for 24 hours a day, it is going to wear out prematurely. The modern solution, fortunately, is very bright. Over the last 20 years, we have developed SSRIs like Zoloft or Lexapro and SNRIs like Cymbalta, which are significantly safer for the cardiovascular system. For nerve pain, we now have medications like gabapentin or even topical lidocaine that do not interfere with the heart's rhythm or your blood pressure. If you are taking amitriptyline or any older antidepressant, please do not stop taking it today. These drugs must be tapered slowly to avoid withdrawal syndrome. But I want you to make an appointment with your doctor or a geriatric psychiatrist. Tell them, I'm concerned about the anticholinergic load of this medication on my heart. I'm worried about my fall risk and my heart rhythm. Can we explore a more modern alternative that protects my independence? Your mental health is vital, but the treatment shouldn't cost you your ability to walk safely across your own home. Now we come to perhaps the most controversial topic in senior health today: calcium supplements. For decades in America, the bone health dogma has been inescapable. We were told by every magazine, every TV commercial, and even our government health guidelines that as we age, we must take massive doses of calcium, often pound $200 billion to $1,500 billion in pill form, to prevent the brittle bones of osteoporosis. We thought we were doing the right thing. We thought we were building a fortress for our skeleton. But as a cardiac surgeon, I have to show you the missing page of that story. While your bones need calcium, your arteries hate it. I want to introduce you to Linda. Linda is 70, a non-smoker, a regular at her local yoga studio, and someone who eats a heart-healthy Mediterranean diet. By all traditional metrics, Linda's heart should have been perfect. Yet, Linda suffered a heart attack. When I took her to the cath lab to clear the blockage, I didn't just find soft, fatty cholesterol. I found calcified plaque. It was as hard as a rock. Linda had been taking a high-dose calcium carbonate supplement, 1,200 mg every single morning for 20 years, because she was terrified of shrinking as she got older. She thought she was feeding her bones. In reality, she was petrifying her arteries. To understand why this happens, we have to look at how your body handles food versus a pill. When you eat a bowl of Greek yogurt or a serving of sardines, the calcium is bound to proteins and fats. Your body digests it slowly over several hours. The calcium enters your bloodstream in a slow trickle, like a gentle rain that the soil of your bones can soak up. When you swallow a 1,000 mg calcium carbonate pill, it's a different story. Within an hour, that pill dissolves and creates an artificial calcium spike in your blood. Your body suddenly has a massive flood of calcium and nowhere to put it. Your bones can only absorb so much at one time. Where does the excess go? It doesn't just disappear. In many seniors, that excess calcium begins to settle in the soft tissues. The most dangerous place it settles is in the walls of your arteries. This is a process we call arterial calcification. Think of your arteries like a brand new flexible garden hose. You can bend it, twist it, and it handles the pressure of the water just fine. Now imagine if you lined the inside of that hose with a thin layer of concrete. The hose becomes stiff. It can't expand when your heart pumps. This stiffness causes your systolic blood pressure, the top number, to skyrocket. This is why many seniors have a high top number but a normal bottom number. Their pipes have lost theirs give. Even worse, that calcium acts as a glue for cholesterol. It traps fats in the artery walls and turns a soft, manageable blockage into a hard, calcified plate. These hard plaques are what make heart surgery so difficult and what make heart attacks so much more likely. The scientific community is currently debating this intensely. Large-scale studies, including some from the Johns Hopkins University, have found that while dietary calcium from food is protective, calcium supplements are associated with an increased risk of heart disease. The evidence isn't 100% settled, but the signal is strong enough that we must change our approach. The small change, big difference strategy here is to pivot back to food first. Most people can get all the calcium they need through diet. Dairy. If you tolerate it, yogurt and hard cheeses are excellent. Canned fish, sardines or salmon with the soft bones included, are calcium powerhouses. Leafy greens, kale, bok choy, and collard greens. Fortified foods. Many almond milks or cereals are fortified in a way that is absorbed more gradually than a pill. If your doctor has diagnosed you with severe osteoporosis and insists you need a supplement, you must ask about the supporting cast. Calcium does not work alone. For calcium to reach your bones and stay out of your heart, you need vitamin D3 and, most importantly, vitamin K2. Think of vitamin D3 as the doorman that lets calcium into the blood, but vitamin K2 is the traffic cop. K2 activates a protein called MGP that physically sweeps calcium out of your arteries and directs it into your bone matrix. In the US, many seniors are taking D3 and calcium, but almost no one is talking about K2. If you must take a supplement, my recommendation is to split the dose. Don't take 1,000 millimoles at once. Take 500 millimoles in the morning and 500 million in the evening, always with a meal. This reduces the spike and gives your body a better chance to manage the load. Your heart and your bones shouldn't be at war. By moving away from mega-dose pills and returning to a nutrient-dense diet, you can protect your height and your heart at the same time. We have covered a lot of ground today. We've looked at the hidden strain of pain relievers, the mineral theft of stomach protectors, the dangerous pressure spikes of cold remedies, the electrical interference of old antidepressants, and the arterial hardening caused by calcium spikes. I know this might feel like a lot of don'ts, but I want you to see the do. Do become the CEO of your own health. Do recognize that you have the right to question a prescription that was written for you 5 years ago. Your heart is an extraordinary machine. It has beaten over 2 billion times since you were born. It has carried you through decades of life, joy, and hard work. It is resilient, but it is also sensitive to the chemical environment you provide for it every morning when you open that medicine cabinet. When you go to your next doctor's appointment, I want you to take a brown bag of every single thing you take, every prescription, every OTC pill, every vitamin, and every herbal natural remedy. Lay them out on the table. Ask your doctor these 3 power questions. Which of these medications is absolutely essential for my quality of life today, and which are we just taking out of habit? Are any of these drugs fighting each other or putting extra stress on my heart rhythm or blood pressure? Is there a lifestyle change or a more modern, heart-safe version of this medication that we can try? You aren't just a patient in a waiting room. You are the guardian of your own independence. Protecting your heart is about more than just a lab result. It's about making sure you are there for the next holiday, the next gardening season, and the next walk with your grandchildren. If this information has empowered you, please leave a comment below. Tell me, I am reviewing my cabinet, or I am talking to my doctor. Your stories of self-advocacy help this entire community realize that we do not have to just accept side effects as a part of aging. Thank you for your time, your trust, and for taking these steps to protect the most vital muscle you have. Take good care of yourself, and I'll see you in the next video. The silent daily accumulation of medication strain is the one thing I hope you carry with you today. If you've spent years reaching into your medicine cabinet every morning out of habit, please know it's not because you were careless. It is simply because no one took the time to explain how these chemicals interact as your heart evolves. You haven't done anything wrong. You just didn't have the full picture until now. The good news is that you still hold the steering wheel. By simply noticing these patterns, You are already regaining control over your independence and your future. If you feel ready to take that next step, please leave a comment with the word advocate or checking below. Following this channel isn't about entertainment. It is a protective measure to ensure you don't miss the early warnings that a rushed medical system often overlooks. In our next talk, we'll dive into a common health food found in most American pantries that may be stiffening your heart valves even more silently than these pills. I share this because I have met too many patients in my operating room who only wish they had known this a decade sooner. Take good care of yourself.